PCOS and obesity, connection and treatment. Obesity is a common occurrence in people with polycystic ovary syndrome. This may be partly due to insulin resistance, which often results from the condition. Medication, changes in eating habits, and regular exercise can help reduce obesity. Polycystic ovary syndrome or polycystic ovarian syndrome is a condition that affects 1 in 10 people who are assigned female at birth. People with PCOS experience metabolism issues and hormonal imbalances that affect their overall health. It is also a common cause of infertility. Not everyone with PCOS will have obesity. However, obesity and weight gain are common symptoms of the condition. This video further discusses the connection between PCOS and obesity. It also explains how obesity affects PCOS and how to manage it. Finally, it looks at the symptoms and treatment for PCOS. How are PCOS and obesity connected? Researchers agree that there are strong links between PCOS and obesity. Between 38 to 88% of people with PCOS have overweight or obesity. The exact link between PCOS and obesity is unknown. However, studies have shown that there are several mechanisms that can mediate the effects of weight gain in PCOS. This include insulin resistance and the effects that high levels of insulin in the blood can have on the body. The studies also state that weight gain and obesity play a part in the development of PCOS. However, PCOS can also play a role in further weight gain and affect a person's ability to lose weight. Some experts believe more research is needed on the connection between obesity and PCOS. How does obesity affect PCOS? Obesity can exacerbate many symptoms of PCOS. This includes insulin resistance, blood glucose levels, and reproductive issues. The Centers for Disease Control and Prevention states that obesity is a body mass index or BMI of 30 or more. While BMI is a common screening tool to diagnose obesity, it is not a measure of a person's overall health. People with PCOS are also at higher risk of developing other medical conditions. This include diabetes, gestational diabetes, heart disease, high blood pressure, high cholesterol, sleep apnea, stroke. Obesity can increase a person's risk of developing these conditions even more. It can also worsen these conditions if someone already has them. How to manage obesity with PCOS? Doctors agree that obesity is a serious issue among people with PCOS. However, some studies suggest that further research and education on how to manage obesity with PCOS is needed. Currently, the first line of treatment for obesity in those with PCOS is lifestyle changes. This includes changing how a person eats and increasing levels of physical activity. Many doctors recommend people see a dietitian as well. Another common treatment to manage obesity in PCOS is a medication called metformin. Metformin is a medication that doctors often prescribe to treat type 2 diabetes. It is not currently approved by the Food and Drug Administration or FDA to treat PCOS. However, doctors often prescribe metformin off-label to help manage PCOS insulin resistance. Off-label means using medication to treat a condition the FDA has not officially approved it for. Metformin can help lower both insulin and androgen levels. Research shows it to have positive effects on reducing body mass and improving cholesterol levels. What are the symptoms of PCOS? Not everyone with PCOS will experience the same symptoms. However, common initial symptoms include irregular periods, ovarian cyst, excess body hair, acne, thinning hair, weight gain. Other symptoms may include fatigue, infertility, skin darkening, pelvic pain, mood changes, depression, sleep issues, some. What are the treatments for PCOS? Lifestyle changes and metformin are two common first-line treatments for PCOS. Other treatments focus on managing various symptoms. These treatments may include hormonal birth control, anti-androgen medications, medication to help stimulate ovulation. Speak with a doctor about other treatment options that may be available based on symptoms experienced.